Hi, I'm Dr. Jeff Borenstein. I'm the editor of Psychiatric News, and I'm here with Dr. Paul Summergrad. Paul is the president-elect and about to begin the presidential year. And Paul, I want to welcome you and say congratulations.
Thank you very much, Jeff.
And ask you about your vision for your term as president.
So I think there's so many amazing and wonderful things that are going on right now in psychiatry. And there are things that we've already been doing that we need to continue. The work on honing our missions in regard to research, advocacy, making sure that we're fighting for parity and for equity, not only for our members, but most importantly for our patients and their families. To make sure that people who have mental health conditions and have mental illnesses are not being stigmatized. And there's still so much of that goes on. So all of those things are really ongoing activities of the APA. We've also, I think, become much better at communicating, thanks much to your work and to work of many other individuals in the organization, in communicating with the media, with the press in general. And I think we need to continue to focus very clearly on putting out that kind of information that's useful to people, policymakers, people in government, families, other physicians. And then, of course, there's the work around healthcare reform and integrated care, which remains active and will become only more important as the Affordable Care Act becomes more fully implemented over the next couple of years. But beyond that, I think that we have a once-in-a-lifetime opportunity. We're at a point where there's a tremendous development in the science, the neuroscience, genetics surrounding psychiatric illness. And while it may take a relatively long time, 30, 40, 50 years to really work through these very difficult and complex problems, I think the technology and the level of engagement both here and internationally is one that will allow us to finally be able to understand much more about not only the causes but the treatments for very, very severe and disabling psychiatric conditions. Secondly, I think that the development of systems of care that are really truly integrated so that people with mental health illnesses are not dying 10, 15, 20 years too soon is going to be very important. And then beyond that, I think as an organization, we need to think much more carefully about what our intermediate and longer term goals are, so that we are really focusing in on those things that we have to do, that we do best, that will support patients, families, and our members, and will also allow us to develop and build the foundation, which has been doing tremendously important charitable work throughout the country. So all of those things are opportunities, and I do think the time is right for us to do some longer range planning in addition to the immediate day-to-day kinds of issues that face the organization.
I think that's a good vision, both the short term and the long term. One of the areas of your expertise has to do with healthcare reform and what that means for our profession.
Right.
For our listeners out there, our viewers out there who are our members, what do you say to them about the opportunities and challenges of healthcare reform?
Well, so one of the opportunities is that as we move into an environment which may be paid differently, less fee-for-service oriented, and more looking at the total cost of care and the total quality of care, the reality is our conditions and illnesses are highly comorbid with a whole range of other medical and surgical illnesses that are not only disabling and cause early mortality, but really are associated with tremendous cost, both immediate healthcare costs as well as costs in human suffering. So when you put all of that together, and you also think about the impact that this has on workforce, productivity, globally, it's true as well. I think the opportunity for us to really now fully and finally embrace equitable and fair and appropriate care for people who have mental health conditions, who are, after all, not strangers to us. These are our brothers and sisters. President Kennedy said 50 years ago when he signed the Community Mental Health Act, he said, those with mental illness should no longer be alien to our affections. And the reality is, they are our family members. They are our parents, our kids, our neighbors, in many cases ourselves. And these are conditions that are human conditions that are treatable by physicians and by human beings. And we have to make sure that we really use this opportunity to provide that care in the most holistic way. What it's going to mean for day-to-day practice, for the practicing psychiatrist. You know, I don't think the individual practice of psychiatric care or psychotherapy or psychopharmacology is going to go away. I do think there are opportunities for new ways of providing care closer in with both community mental health centers, with primary care physicians to be based in public sector settings, with nurse practitioners who may work in those settings, medical nurse practitioners, psychiatric nurse practitioners who may work in a variety of other kinds of settings, to allow us to amplify the work that we do. Because there are a relatively small number of us, and there are a tremendous number of people who need care. So being able to work with a psychiatric nurse practitioner who may be set in a primary care office acting as a care manager, and where we can provide the expert consultation and see patients who are not doing well, and really focus on a total population who's at risk, is an opportunity that a number of senior psychiatrists have really studied, have researched, and there's a lot of evidence that it works well. And it's not something where we get cut out, where we become frankly even more important in those kinds of settings.
And have an impact on patients and families.
And a broader range of people than we could, you know, if we were seeing everybody individually alone. So the ability to have, to amplify our effectiveness, I think is critical. And even today, most of the ambulatory psychiatric care that's delivered in this country is delivered by other physicians, general physicians. So we need to work with our colleagues to make sure that that's improved and is done in the optimal way possible for our common patients.
Well, I want to thank you for joining us in this busy time of the meeting, and wish you the very best over the course of the next year and beyond.
Well, thank you, Jeffrey. It's an honor to be able to serve. I'm grateful to the membership who've put this trust in me, and I look forward to giving my all for the organization.
Thank you so much.